My name is David Scott, the risk and safety for Russell Minor Hockey. Thanks for coming out. Obviously, good interest in this hockey tonight, which is good to see. I know we saw a number of incidents last year that were concerning. And I'd like to thank Dr. Menard for his time. We are so lucky in this town to have Dr. Menard, who's done a number of things for our sports associations and his wealth of knowledge. I'm really blessed. So thank you, Dr. Menard, for doing this for us tonight. And you don't want to listen to me. I don't blame you.
Well, thank you for coming out. I know people are busy and you have other things to do in your lives besides listen to an old guy who thinks he's still an athlete talk to you about things. But I was asked to talk to you about concussion. How many of you have been concussed yourselves? Okay, how many of you have either been concussed or know someone who has been concussed? So virtually everyone. Is there anyone here who answered no to both of those questions? Okay, so just two people. Okay, so you know that just shows you how real. There are some extra chairs there too if you're how real a problem this is. I mean, you know, Sidney Crosby has been concussed, and I mean, I don't think there's anyone in the room that doesn't know that, and you know that. It may have brought this to greater light for people, but it's still, I mean, it doesn't make it any more important a problem because Sidney's been concussed, because you all have your own Sidney Crosbys in your life, every one of your children, and etc. So I really like this picture because it really encourages you to think about what's inside the helmet, because that's a very important thing that is very. You can't buy what's in the helmet at Canadian Tire, by the way, to replace it. So I promised David, I said, I've looked at the literature, etc. I've toned this down, I've cut it and made it more succinct, and I should be able to cram this in about 5 hours. So hopefully this works for you. So I want to give you some a basic understanding of concussions. I don't want you to leave here certified neurosurgeons. I want to help make it easier for you to recognize a concussion when it occurs. I want to teach you a little bit about how they should be treated, not as in I know CPR, but what you can do as a parent or as a trainer or as a coach to help treat this. I want to give you some guidelines on the return to play guidelines, and I want to teach you what you should be doing when you have a player or a son or daughter or a family member who happen to be concussed. And I think those will be easily achieved tonight. So I'm going to give you a concussion quiz, and we'll do it by show of hands, okay? And in the military we say no name, no pack drill, so nobody's counting scores. Most concussions in hockey are caused by illegal hits. How many people think that's true? Very good. Okay, it's false. Most concussions resolve spontaneously. How many people think that's false? Okay, it's actually true. Most concussions, the vast majority of concussions resolve spontaneously. That doesn't mean instantaneously. It means they resolve without any medical care at all, okay? Helmets and mouth guards prevent concussions. How many people think that's true? Okay, regrettably, it is not true. And that is a fact, okay? They do not prevent concussions. And I'll explain that a little later. And sometimes your child puts that helmet on and they think they can become a guided missile and that helmet will protect them from everything. And that is not the case at all. Concussions in hockey are significantly underreported. How many people think that's true? Very good. Children are more resilient to concussions than adults are. How many people think that's true? That is false. Good. Well, you guys are... I'm just going to leave now. You need to lose consciousness to be concussed. How many people think that's true? Good. Okay, very good. Once the headache resolves, players can immediately return to play. How many people think that's true? Wow. Very good. Previous concussions do not increase your susceptibility to future concussions. How many people think that is false? I guess that's a double negative. I mean, so, previous concussions do not increase your susceptibility to future concussions. Is that true? No. Okay, correct. It is false. They do increase your susceptibility. So, you know, you can give yourselves a round of applause because, I mean, to be honest with you, that you did really well on that. The only thing that really deeped you out was the helmets and mouth guard thing. And so you are a lot more knowledgeable than you may have thought you were. So this is the thing that we're talking about here, really and truly. Your brain, when they operate on your brain, it has the consistency of something a little bit firmer than Jell-O, but not a lot firmer than Jell-O, okay? And it sits in a cement box that is quite tight. There's not a lot of room. There is a little bit of room, but not a lot of room. And when you get bouncing, take a bucket, take a cement bucket and put a blob of, ladies, you have those forms, you know, you can make a Jell-O, I don't know, a Jell-O building, I guess, or Jell-O structure, and stick it in the cement box and jiggle it around for a while and see what it looks like when you actually open the box again. Well, that's what we're really talking about in terms of how delicate this structure actually is. So here's the definition, and there are all kinds of very complicated definitions, and this really cuts to the chase. A concussion is a disturbance in the function of the brain caused by either a direct blow, bang, or an indirect blow, body check, or something like a whiplash, okay? And the critical word here is it's a disruption in the function of your brain, not in the structure of your brain. So it's kind of like me taking this computer right now, no, David, relax now, and dropping it on the floor, and I don't do any damage to it, but it kind of gets screwed up for a while, and we're going, how come it's not working anymore? And then all of a sudden it just sort of shakes its head, and then it's back to functioning properly. So this is your direct blow. This is probably this player will argue that this was a legal check, but that elbow is being, you know, shoved down that guy's throat, snapping his head back quickly, and his brain is then being traumatized. So that's the direct blow causing the concussion. And this is the indirect blow. This is just a big collision where the two players run into each other, and this guy is concussed not necessarily by hitting his head on the ice when he goes down, just the actual trauma of hitting this cement wall. So let's talk about some concussion facts. It's the most common head injury in hockey, okay? I see a lot of old-timer hockey players who come in and they're not wearing, they tell their children to wear masks or visors, but they don't. And my most common old-timers thing is a cut on the face from a puck or a stick. But as a whole in hockey, it's concussions for head injuries. You do not have to lose consciousness to be concussed. In fact, that's very uncommon. Or not, I shouldn't say very uncommon, but uncommon. They don't always produce memory problems. So I just saw a concussed hockey player from an elite school in Niagara this weekend, and that person definitely is concussed, and they've had no memory problems whatsoever. The symptoms can be delayed several hours, so just because I am I never behave normally, but just because I'm behaving more abnormal than normal, then you have to wonder about that, and then it may be delayed for several hours. I had a player who got concussed on the field training for the World Cup, came out and challenged the striker, and actually was flipped right up in the air and hit her head. And she was instantaneously drunk. I've never seen that. Like, she was drunk. Like, everything was funny. And everyone's looking at me going, what is wrong with this? She's so quiet and so serious. And it was like you'd given her a Mickey before the practice started. And she stayed like that for about 36 hours. They vary in severity, okay? You get the Sidney Crosby kind of concussion where it's, it's very prolonged departure from hockey all the way down to, people call them, I got a ding or a buzz, playing. They are functional disturbances with no obvious brain damage. So when they get these things, they study the guy or gal and they do an MRI or a CT scan of the brain and they can show no structural damage to the brain. I'm not a neurosurgeon and I certainly don't profess to be, a world-renowned person in terms of concussion, but I do not believe that when you're concussed there isn't some damage to your brain, microscopic damage. I could say to you, I can look at this gentleman in the front skin and say, I don't see any bugs on his skin, there are no bugs on his skin. And if we take a bigger and bigger and bigger microscope and we look closer and closer and closer, everyone in this room has bugs on their skin. You're normal, it's the way we are normally. And so I think that just an MRI, if you have a tumor in your brain that is smaller than a sugar cube, the MRI might miss it. That's the resolution power of these things. So you can imagine if you have these microscopic connections to the neurons disrupted, the MRI machine is not going to show that. So that's why I use the word no obvious structural damage to your brain. They're typically short-lived, as you got from the question that we did, usually about 7 to 10 days in length. And children recover much more slowly from concussions than adults do. You have to appreciate that your child's brain is growing. And in fact, male brains are maturing. I'm not even sure I should say this because it'll arm the ladies in the room with much more ammunition than you. My wife will probably testify that at 57 my brain is still trying to mature, but about 25 years of age the male brain is still maturing, still growing. So everyone in this room has, except for probably that young fella there, has a brain that isn't growing anymore, and so you have this stable structure, whereas if you have this growing structure and you damage it, the chances are you will have a bigger impact than if you have a stable, mature structure. And virtually, not all, but virtually all concussions that you see resolve without any kind of treatment. And unfortunately, they are often unrecognized when they occur. So why do so many concussions go unrecognized? This is not hard to see. And you've got a player lying on the ground there that can't actually talk to you or can't get up. They have no idea what day it is and they have no idea where they actually are. You can't really miss that. Well, there are reasons. First of all, many players don't recognize that they've been concussed. And they truly don't. I don't recognize that I've been concussed. And they're not really the best people at the time they're concussed to actually assess if they've been concussed, So you're kind of going, no, your opinion in this case really doesn't matter. You have been, you're not thinking straight, and we'll talk about it later. Many coaches and parents don't know what to look for. So, it's the same thing. You hear people say, I didn't know my son was a drug addict because I didn't know what to look for. I didn't realize those needle tracks on the inside of their arm were a sign that they were shooting heroin. I didn't realize this rapid change in behavior, this enormous drop in their school performance, their sudden secretiveness, were signs that they were a drug addict. It's the same with concussion, I was talking to a parent this week whose child was concussed. Child is away at an academy, and so they talk on Skype. The parent immediately was aware that this is not my child on this screen. Who is this person and what are you doing in my child's body? And then within several days, as the concussion resolved, the parent said, oh, you're back, it's good to see you again. And so they recognize that change in behavior. But if you're not looking for it, you might not see it. And some players hide their concussions, okay? And you can, if you, I'm sure that, let's, somebody tell me, why would a player hide a concussion?
Doesn't want to be benched.
Doesn't want to be benched. To keep playing. Anything else?
It's a sign of weakness.
Sign of weakness. Yeah, I don't want to be a pussy. Anybody else? Fear? Yeah. Anything else? What about that big contract, you know? You know, Sydney doesn't have to really, I mean, Sydney, it hasn't made in the shade for the rest of his life. I mean, but if Sydney was about to sign his professional contract and he'd had this happen when he was playing in the Junior A program, the Major Junior A program, this would have been a showstopper for some clubs, and market value would have gone down. And you know, you talk about, you probably read some stuff recently about the, you know, the enforcers, okay? And one of them said, we're just pieces of meat that actually get, you know, shipped around the NHL and stuff. And even when I use that term to you, market value, I mean, that is treating them like they are meat. I mean, you know, what's your market value, you know, etc. But that is reality for these guys, is that they realize that, you know, if I'm going to make it, I got to make it, you know, without this career-ending thing. Marian Hossa, when he came to the Senators, they sent him down to the American League, and the first thing that happens to him is he gets his, I forget which knee, but he gets his knee destroyed on a knee-on-knee hit, tears his ACL, and has to have reconstructive surgery, and he hasn't played in the NHL yet. And fortunately for him, you know, he was rehabbed and he's come back successfully. But these are the concerns that these guys have. Now, the chances of any of you having an NHL player in this room are fairly small. There may be one of you, but still, your kids have other reasons, you know. So they want to finish the game. They don't want to be cut. They don't want to lose their career. They don't want to be a wimp. They don't want to let their team down. And some of them feel pressure from their parents and their coaches. And I'm here, I'm embarrassed to tell you that my daughter played hockey, women's, you know, traveling hockey until she was about 17 or 18. And then she said, I'm not going to play anymore. And then the thing that hurt was she said, I actually played the last season just for you and Mom. I didn't really want to do that. And I said, oh my God, you know, honey, I'm tired of driving you around your arena. And we should have communicated better with each other, you know. And so anyway, those are real issues for these young folks. What are some of the risk factors for getting concussed? You know, and the world is not entirely fair in terms of gender, but females are more vulnerable to being concussed than guys are. And last season, or last year, we had two hockey players, one who played other sports at the same time, but male and female, both concussed. And both required about 4 months before they could actually get back to playing sports because of the severity of the concussion. Age. You know, the younger your children are when they get concussed, the longer it's going to take for their symptoms to resolve. And this has to do with this immaturity of their brain. And then this history of previous concussion. If you've had, how many of you have seen Muhammad Ali since he's developed his Parkinsonian-like syndrome? Okay, that's just from multiple beatings on his brain. If you ever saw some of those fights with him and George Fraser, I mean, they were literally trying to kill each other in the ring, and that kind of trauma to your brain took its toll on him in particular. Behavior, okay, risk takers. You know, I see some of this stuff on the internet because when I do talks, pictures say so many things, and I like to use visuals because people go, whoa, like that's horrible. But you start looking at some of the crazy stuff that people are doing on and broadcasting on the internet, and it's frightening. I mean, some of the stuff they do on these mountain bikes and trip bikes and motocross bikes and rollerblades and skateboards, you know, they're crazy. It's crazy stuff that, you know, we used to pay to watch Evel Knievel do that stuff, and now they're doing it over there beside the tennis courts here in Russell on that equipment, and they are taking risks. And you know, even though women are more vulnerable to be concussed, they're generally a lot smarter than the guys are. So it's the guys that are usually the risk takers doing those absolutely stupid things, and trying to really keep our gene pool a little cleaner. And then medications. If you happen to be on a psychotropic drug for depression or anxiety or schizophrenia, etc., you're a little more vulnerable. And if you're on anticoagulants, so obviously if we're trying to keep your blood a little bit thinner and you get hit in the head, then you're obviously going to bleed a little easier than someone who isn't on an anticoagulant. So these are the symptoms of concussions, okay? And they're not all inclusive. I mean, you'll meet people who will have different things. You won't see talking like a drunk person on there, but that was certainly our female goaltender. But the classics are, I have a headache, I feel dizzy, I feel like I have ringing in my ears, I'm dazed or confused, and the world seems to slow down for me. And you know, you're talking to them and it's like, hello, John. Hello? Yeah. Put me in, coach, put me in, you know, and John, yeah. You know, and they're fading in, they're fading out. They're tired, they may be sensitive to light. They get this sensation of pressure in their head. They may feel nauseated and they may vomit. And vomiting, you know, doesn't have to be a sign that you have rising pressure in your brain. It could be, but it doesn't have to be. Many kids who get their head hit will throw up fairly soon after. It's the ones who keep throwing up that you have to worry about. They just don't feel right, they're drowsy, and they're seeing stars. Now, you can't, if you take this list home, you can't go, well, Susie, you got all but number 5, so you're not completely concussed. Now, if you have any of these, you have to worry that the person's concussed. So it's not all inclusive. But the more of them you have, the more you can be certain that your child or yourself or someone else is concussed. So those are the symptoms. Those are the things that they're experiencing. I can't examine your nausea. You know, you could all, I'm talking, you're probably all nauseated. But I can't tell that. But I can tell signs. If you're falling asleep while I'm talking, then I know that we're not resonating with you, etc. So, you know, I've been hit and I get up off the ice and I'm coming to the bench and I'm kind of like, there's the bench and I'm trying to get there and it's like, you know, that's a bad sign. You know, because this coordinated athlete is having trouble making his or her legs get to the bench. Changes in personality, that serious, very quiet goaltender in soccer who turns into this outgoing, very bubbly, giggles at everything person was, you know, that personality change was instantaneous with her hit. Amnesia, what happened? Like, where am I and what happened and why am I here on the bench? Well, you don't remember running into Freight Train Jones in the corner? No. And so that amnesia could be before the event. I may remember everything, but I have no idea what happened after the hit, or you could be mixed up about both ends of it. that vacant stare, so that either means you're a rugby player or you're concussed. So if they're trying to chew on your arm, then you know that they're a rugby player. And slurred speech, a change in your vision, irritability, reduced memory, slower reaction times, and loss of consciousness. Now, this, I want you to think about this, all of those things. Like I'm a good hockey player, and I know that there's the puck, and I know that I can get to that puck before you can get to me. I mean, you know your skill set, and you've been playing for a long time, and so I go to do that, and I just scoop the puck up, and I'm gone. My brain doesn't know that I'm concussed, and I don't know that my balance is gone, and that the world has slowed down for me, and that I have slower reaction times, and so I now make this move to get away from you, which should be real easy, and oh my God, there they are. They're about to murderate me, and I get hit. And so now I'm concussed, and I have an ACL tear in my knee because I couldn't do anything to protect myself because my reaction times are out. And I'll give you a personal example of that. I had a disc injury about 10 years ago that ended my playing soccer. And I was an aggressive keeper. I would come out of the crease and I could attack the ball and get to it before the strikers could. And I remember the first time I tried playing after that, I went out to attack the striker. This was no problem. And I went out and I actually realized halfway there that I wasn't going to get there before the striker. And then you could see this poop-eating grin on the striker's face as he realized that this keeper is lame, and I was hopeless after that. I did not know, because I didn't have any time to adjust the way I learned to play, because I was in the middle of a game. I was a lame duck in net, and I had a very restricted zone, and it was a frightening feeling. Now, I ended up running into that striker just because we both got there, and I should have been there much earlier. So I could have been injured, and obviously for different reasons than this, but that's what I'm trying to tell you is you put that concussed player out onto the ice, and now not just their brain is at risk, but the rest of their body is at risk. The danger signs. So those are the signs and the symptoms of somebody who is concussed. What should you be worried about? Well, these are things that you need to, these things may indicate, not absolutely indicate, but may indicate that there's something more going on here than just being concussed. A headache that keeps getting worse. Remember that cement block I told you about that brain sits in? That cement block doesn't stretch. And so when you start to bleed from inside your brain, that blood starts to produce pressure. It can't move the concrete, so it starts to put pressure on the soft thing inside there, the jello, and that's where this excruciating headache comes from. Your brain doesn't have a lot of holes in it. You have some here, you have some here, but you have a big hole in the bottom where your spinal cord comes out. And if the pressure gets big enough, it'll actually push your brain down through that part, and that's actually when unfortunately, when God designed you, your breathing center happens to be down in that area, so it gets pinched and you're in big trouble. So, an progressively increasing headache, you need to take that child to the hospital because they may have a bleed in their brain. Drowsiness, or you can't awaken them. So this is one of the reasons we tell you if your child's been concussed when you go home, you need to wake them up every couple of hours and say, hey, Johnny, make sure, Johnny might not be able to sing, the alphabet for you, etc., but at least they should be rousable. Yeah, Mom, yeah, go away. But if you can't rouse them, you can't wake them, you can't get them to respond, again, that may be an indication of rising pressure in their brain, and you need to take them in. Repeated vomiting, not just vomiting. Like I vomited, 5 minutes after I got hit. So I vomited, and then I go home with you, and I'm vomiting, and I'm still vomiting, and I keep vomiting. Again, if you have increasing intracranial pressure or pressure inside your head, you will do that. Seizuring. You will see this. I did not have the ability to get a video for you, but you've probably seen, I don't know if you can see this, but when a hockey player gets hit, you'll sometimes see this happen. Bang! And they'll do this. Have you ever seen that? Okay. That's not seizuring. That's a concussive posture. And I remember learning about that in Calgary, and then going to this event of the Calgary Stampede, and this guy got hit by a bull, the clown guys, and this bull was unbelievably aggressive. And he just laid there, and then all of a sudden did exactly what they said that this guy would do post-concussion. But seizuring, the funky chicken kind of thing where you're actually moving like that, especially if it occurs, 30 minutes, 60 minutes after the concussion has occurred, that's again a worrisome sign that something's going on and they need to be going in. Deteriorating mental status, increasing confusion. So, Johnny, 2 hours after his headache, was answering questions and doing fine, and then you say, well, Johnny, it's time to go to bed, and he says, well, Mom, no, elephants don't eat marshmallows before they brush their teeth. You say, what? And you then realize that Johnny is in La La Land, like nothing that Johnny says makes much sense. And that serial deterioration of Johnny's mental state is something that is worrisome. As a coach or a trainer, if you come out and you've got a player on the ice that's been hit big time, and they tell you, I'm having numbness or tingling in my hands, or I can't feel my hands or my feet, don't move them. Like, do not move them. Do not let them move. Don't let the referee move them. It doesn't matter. I've been in situations, at the World Championships or wherever, and the person's saying to me, there's television cameras, we have to get going, and you're going, I don't give a shit about your television cameras. This athlete is not moving until we actually get them stabilized and safe. Go wait. And so you actually take care of them and get them going. So you can get some pressure because the referee you've probably seen this, the referee's standing there and going, well, how much time do you think this is going to take before you can get little Johnny? And you're going, no, Johnny's not moving. You have to get an ambulance here and get Johnny. And never be afraid to make that call, okay? Because to be honest with you, if you actually stop and think about it, nothing in the world is going to change whether your team beats, Kempville 57-0 in hockey, or you get beat by Kempville 57-0. Your life isn't going to change, but if little Johnny is a quadriplegic because you moved him, little Johnny's life has changed dramatically. So never let anybody pressure you into moving somebody. If you see any of these signs in your athlete, they may be bleeding and they need emergency assessment, okay? So you need to get them in. Don't phone me or any of the other local doctors and make an appointment for that type of presentation. You've got to either call 911 or get them into the hospital immediately, okay? And this is a CT scan. This is what your brain looks like normally, and this is what happens when you have bleeding in the subarachnoid area, and that's the blood is giving you pressure on this side because, as I said, this is the skull. The skull isn't going to move at all, so the pressure that's building up has got only one direction to go, and it starts collapsing the brain over to its side. And if you could actually take a Black & Decker drill, I'm not recommending you do this, and drill a hole right there and drain that blood out, the person would be relieved, okay, that pressure, and they would respond remarkably. My dad had this, and he's got, 2 or 3 burr holes. They literally do, just drill holes, They drained the blood out of that area, and my dad, came to right after. You don't really have to worry about Homer being concussed because there's not a lot of functioning tissue there in Homer's head. But for everybody else, the consequences can be significant. So the take-home message on this is that most concussions resolve, quickly with no long-term consequences that you can see. Thank goodness for that. But there is an increased risk of future concussions, so that's one of the consequences of a concussion. There's an increased risk of more concussions in the future and more severe concussions. So, if we had a little machine that punched Johnny in the head with exactly the same force every time, the consequences of the same punch would be greater the more concussed he becomes, okay? So it takes less to do more damage. Depression. One of those young people that I saw last year was depressed after this injury, like clinically depressed after this injury. And I don't know whether it was from the brain trauma or from the fact that this young person was so heavily invested in sport, that this is who I am. I'm Susie, the elite soccer player who was the best athlete in school. And now I'm Susie who doesn't have a broken arm. I can't walk around the school with a cast and say, hey, look, this is why I'm not playing sports. It's a blind injury. It's the same as soldiers, You see the amputees who come back from Afghanistan, we refer to them as war heroes, and I am in the military and I have that same view. But the soldiers who come back mentally traumatized with PTSD, they're treated quite differently. They're actually, we used to call them inefficient soldiers. That was the diagnosis, an inefficient soldier. And they have this, they don't have anything to show. I don't have any scar. But I'm just as traumatized as the guy who has his lower limb blown off. So this little person has nothing she can show anybody to explain why she can't play sports. But every time she tries to play sports, her headache and her dizziness and her symptoms return, and so she gets depressed. So I don't know in this case whether it was the trauma or the social situation or both. Post-concussive syndrome is when you have these things last. And you'll read stories about professional wrestlers, professional football players, professional boxers who say, my career ended with this one particular hit, and now I have dizziness and ringing in my head, and it's not going away. It's just there all the time. And so that's a very serious consequence of this. And then chronic traumatic brain injury. You get hit often enough, and those little micro things that I suspect are occurring become more macro. And it's the same, there's many of you that I've seen as patients, and some of you I've said, they say, well, where did this come from? And you say, well, you were doing this, painting your house, and you pulled on that tendon enough that you had these little tiny tears. And you kept doing that, and the little tiny tears became a little bit bigger, and then they became a lot bigger, and then this thing became really inflamed. And it's the same with the concussion. You have these little tiny injuries, and they become bigger and bigger, and then you have something that actually can be shown on an MRI or a PET scan to be real damage. So these are serious things, and some of them, like post-concussive syndrome, may be permanent, and this certainly is permanent, and then the ability to continue playing body contact sports, this may be a permanent impairment to you being able to do that in the future. So there's a worrisome sign. When I go away with events now, I have an athletic trainer or a physio with me, so I don't go on the ice unless I'm alone. So that's the trainer telling me, we have a serious problem here, and I need you in here right now. And he's stabilizing this person's neck till the team gets there. So, and this is the thing, one of the things that people do not understand about concussion, and everybody is beginning to become a little more knowledgeable about the fact that you need to keep your kids away from playing sports, but the cornerstone of treatment is physical and cognitive or mental rest. So if your kid is staying home from school because he can't play sports or whatever, but he's sitting there all night long playing Nintendo with his concussion, he's actually making things worse. And we just had this guy at a big school get hurt, and they sent him home and said he can't stay in school because he can go home with you for the next till his headache goes away because he's not going to class. We won't let him. And we've taken away all of his cell phone and his texter and all that stuff and all of those computer games because he has to go home and mentally rest. So you need to keep that in mind. No significant physical exertion, okay? So they need to rest, which is difficult. How do you get a 10-year-old boy who, you know, every morning you look up and he's hanging from the tree eating bananas and going, you know, and he's not far from a chimp in terms of mental function or physical function or personal hygiene. And you're telling him to slow down. And it's not very easy to do. And no activities that require concentration, including schoolwork, TV, video games, text messaging, reading, you know. That's a little harder to enforce. And the one thing you got to try and impress upon the young person is that by ignoring these recommendations, they're keeping themselves out of sports longer because their concussion is going to last longer because of them doing that. So now you've got your child or your player, they listen to those things, they're a really good listener, they've physically rested, they've mentally rested, and they walk in like this young guy did this weekend and says, I have absolutely no symptoms. My symptoms are completely gone. My headache's gone, my balance is back, my concentration's back, and mom confirms, yes, this is the son that I've come to know and love. And so now, what do you do with this guy? Do you throw him back out onto the ice and say, go? And the answer to that is, as you correctly identified at the very beginning of this talk, the answer to that is no. So, the no activity, complete physical and cognitive rest. When they're symptom-free, you can go to the next step. And this is the most, for the coaches in the room, this is the most important messages, this last slide. And you need to remember these things. So now you can try Johnny or Jill on some light aerobic exercise. So you can get them out and they can go for a jog, or they can go for a little bicycle ride, or they can go on your spinning machine, or they can come and do something that it doesn't involve skating necessarily. No push-ups, no weightlifting, nothing in terms of resistance training. If Johnny or Jill get their headache back, they're not ready to move forward. So they actually have to go back to the rest from mental and physical rest stage until their symptoms are gone again. And then they can come back and try the easy jog again. And this is where Sidney Crosby has been stuck, is trying to take a step forward. I have symptoms again. Take a couple of steps back, Sidney. Okay, there you are. Okay, come on back. I have symptoms again. So he cannot, he's been out since January trying to make this transition on these very simple things. And he's made the transition. Well, we'll get to that point here in a minute. So sports specific. If he or she can now jog or bicycle and they're not having any headache, and let's say that was, you know, Monday they're symptom free for the first time. Tuesday they can go out and jog and they have no symptoms. Wednesday you can put them on the ice to skate. Just to skate, nothing else. Just skate around, you know, and no drills, no body contact, no shooting, just get out and skate. If they can do that without a headache, then the next day they can do non-contact drills. So you get them out and you say, okay, we're going to do the cones, we're going to go down and we'll do some loops around here. You'll come in and you'll do a shot at the goalie, and you know you'll reintegrate them into the team. But you have to shirt them. I don't know how you do it as a team, but often more senior teams will put a pink shirt or a fluorescent something shirt on a player, which is the don't touch this player shirt when they're on the ice in terms of body contact. And now they can start doing a little bit of weight training. If they can make that grade, then they go to being able to do some body contact in controlled situations. And if they can handle that in your practices, then they can actually return to play. At any point in time, I might make it, you know, day one, I'm here, that's good. Day two, I'm fine. Day three, I'm fine. I go to here, I got a headache. So I go back to here. I stay here, my headache's gone, I try here, I got a headache. I come back and I stay here. When my headache's gone, I can come back here again. And you just keep going back and forth until the person can actually make the step down, okay? And that's the recommendations that the International Society for Concussion has recommended worldwide, and that's what they use, you know, for elite, like Hockey Canada, Soccer Canada, Rugby Canada, all of those teams. These are the criteria that we used at the Commonwealth Youth Games that I was just at. That's how we would have approached any of our concussed boxers or rugby players. So, as I said, if you are fast-tracked, you know, the minimum time frame to recovery to be able to return to play is going to be a week. I got hit, I had a headache. For one day, my headache's gone, and then boom, 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 you go through those steps. That's the fastest you're going to get back is in a week. They didn't really do that with Sidney Crosby, I don't believe, on his first concussion. And that may have been the mistake that they made. And you got to understand that these things are steps. They're not days. People make that mistake. They say, oh, day one is this and day two. It's step one. So don't start thinking of it in terms of days. You got to do step one. Going to step two could take you 2 weeks. And then to step three, it takes a day, and then step four might take a few days. So think of them as steps and not as days. So, how many of you are coaches? Okay. How many of you are trainers? Okay, wow. And how many of you are interested parents? Okay, so I mean, coaches and trainers should be like this when they're working. I mean, you need to be very consistent with your players. So this applies to the trainers and the coaches together. So take care of the ABCs first, okay? By that I mean that your players got hit on the ice. If they're not breathing, whether they're concussed or not doesn't matter, okay? They're going to be dead in a few minutes if they're not breathing. If they're bleeding to death, they're going to be dead in a few minutes, so you have to take care of that, okay? And if they have to have cardiac function. So for the trainers in the room, you got to take care of those things ahead of course, the concussion. If they're unconscious, I can't ask you how you're feeling. So you have to assume, the safe assumption is that you've had an injury to your C-spine, because I don't know. Especially if you see a player who's been hit from behind and they hit the boards like this, and then they crumple in as they go, and they're unconscious. You have to play that as a C-spine injury. I don't know how many times I've had C-spine removed people from surfaces with suspected C-spine injuries, and never had any of them ever be C-spine injuries. The only C-spine injury I've ever had was on my table, and I made them do this and this and this and this and this and this and this after they'd been cleared by the radiologist and the emerge doctor. And then I went and looked at their x-rays and said, what is that big line across their second cervical vertebrae? And they went, oh my God, what will you do? And I said, well, you just had me move his, I could have quadriplegicized this guy right away. If the person's conscious, you have to remove that player from the game or practice, and do not let them come back to play until they've been medically cleared, okay? Just don't take that responsibility on yourself. I'm not trying to boost my practice income with this recommendation. Get recommendation from your family doctor or whoever. I don't need any boost into my practice. But you need to have somebody cleared. Don't leave the patient alone. Oh, Johnny, you got a concussion? go sit over there in the garbage can and the game will carry on. You need to either have a parent, if you don't have a trainer, you have to have somebody watching Johnny, like making sure that Johnny is actually still with us on planet Earth throughout this process, because you need to serially evaluate. Johnny, are you still there? How many fingers, and ask, where are we? What's the day-to-day? What are we doing here, etc. And they shouldn't. The answers to those questions shouldn't be getting worse. Johnny should either stay the same or be getting better as time goes on. Have your trainer assess them and do serial assessments if you have a trainer. So that's the don't leave them alone part. And don't give them any medications. If Johnny's got a splitting headache from the thing, don't mask that headache by giving them medication and they're going, well, we didn't know how bad his headache was because we gave him 7 Tylenol 3s and he slept for a week. And he didn't poop for a month. And then have them assessed by a physician and don't let them return to play until they're medically cleared. So there's nothing super complicated about that. If it's a serious injury, make sure that you've taken care of these. Unconscious, protect their C-spine. Conscious, get them out of the game. Don't leave them alone. Have your trainer assess them. Don't give them medications and make sure they see a physician. And do not let them back to play until, I always give the player, dear coach, John's cleared to play. Or, dear coach, John can now start skating. But the instructions will be clear. And follow those return to play guidelines. David has a copy of this on his machine, and if you want a copy of this to refer to, you're more than welcome to. So, I just told you earlier that there's really not much you can do to treat this problem. So, if you can't treat this problem, then the smartest thing you could do is try and prevent it, because you can't stitch your brain back up very easily. And so what can you do? What can you do to prevent these types of injuries? Well, I told you I'd come back to this. Helmets are designed to prevent skull fractures. They are not designed to prevent concussions. So, they dissipate force so that it doesn't smash you directly and crush your brain. It actually disperses it over the surface of the helmet. But the general force that shakes your brain around, nothing can stop that. I can give you a knee brace that protects your ACL, but I can't give you a knee brace that protects the meniscus in your knee, because the meniscuses in your knee are irritated by twisting, and we don't have braces that prevent you from twisting on your knee. So you have to keep that in mind, that the helmet isn't going to prevent concussions. Mouth guards are great. They prevent oral trauma, dental trauma, but they don't prevent concussions. So keep your kids wearing them, but don't think of them as, oh, my kid's got a helmet, my kid's got a mouth guard, he'll never get concussed. This is where you as coaches and parents have a big influence on players. Head hits, that one thing I showed you where that player is hitting the other player with his elbow. I mean, you watch this in the NHL, I see this all the time, and players skating along, and all of a sudden he's flying through space like he's been hit by a baseball bat out of nowhere. And those types of hits are what do this. And they are what are taking big players out of the game. And believe me, what happens on the big player ice is watched by the little players, and the little players start doing this to each other as well, okay? So as coaches and parents, you really do have the ability to say, this is not acceptable play, and we don't encourage it, and make sure that that's drummed into them. Checking from behind is the other thing. Players are defenseless in these positions quite often, and checking from behind is a major thing that can cause this problem. So again, if you teach your kids to avoid doing that, that's great. And then this is a very undervalued comment, but you do need to teach your players to respect their opponents. at the end of the day, you know, you're not my enemy, you're just the guy I played hockey against who was better than I was and beat me today. And, you know, at 5 years old, we can't shake hands and go to the bar and have a beer together and laugh about the game, but you need to teach these kids to respect each other. And I've been in situations where I've been very mad at the arena, you know, what's going on with my kids on the ice, thinking, you know, those bastards, you know, from Chatham, you know, or wherever. But you've got to try and stay calm about these things, and the kids and the parents and the coaches, we need to be very respectful of our opponents. So the summary, just to remind you, concussions are invisible injuries. You know, your kid's not going to come home with a big, you know, Frankensteinian scar on their head saying, "Oh, I've been concussed." And a concussion is not a ding. Okay, I hate it when people say that. I got dinged. It's a brain injury. Saying the kid got dinged is demeaning what this really is, and it's actually minimalizing what it really is. It's a brain injury, and you need to think of it that way. Please, I hope tonight has helped you to be able to recognize the injury just based on the signs and symptoms. If you have any doubt that a kid's been concussed or seriously hurt in any other way, when in doubt, sit them out. Believe me, you know, I'm in this, sometimes, you know, people say, "Oh, you're so lucky you get to travel with these teams and go around the world doing this stuff." I'm often in situations where the coach is looking at me and going, "This is the World Cup. You've got 30 seconds to tell me whether this player can get back on the field. We're down 1 goal, and I have no substitutes left if I put someone in for this person, and you have to be right." And you're going, and I'm looking at myself and I'm saying, this is a 16-year-old girl, and I don't really personally give a shit about what's going on in the game. I'm going to care about this 16-year-old girl. If I think it's better for her to be off, then I say to the coach, "She's off, you do the substitution, and I'll deal with you later." And so you need to do that, okay? Some of you may eventually play it at that level or be at that level in terms of the kind of decisions you have to make, and when you get there, you'll understand what I'm saying in terms of it still doesn't matter, you know, whether you win the World Cup or not. She still needs her brain for the rest of her life, and having a World Cup title won't make life any easier. And then please just make yourself familiar with those guidelines in terms of return to play. That's all I had. I wanted to make it short and sweet, informative, try to target it to you. I hope you got something out of it. I would like to open it to the floor if you have any questions or concerns or comments. I'd be happy to take them. Yes?
Yeah, I'm just wondering, are there any studies done on the differences between vertical and horizontal hits?
In terms of how much trauma there is to the brain?
But also the symptoms, like are they finding that there's different symptoms involved?
Yeah. I'm not sure. I'm not aware of that. I can tell you one thing, that the brain doesn't do as well being spun as it does being hit in an up and down direction. That's the brain. The spine does way better being spun and not being hit that way. Your spine doesn't, like going into the boards head first and then going bang, 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 bang with your vertebrae, your spine doesn't like that at all. But if I hit David like this and he goes straight back, that's a lot better than going like that and making his head spin around. Because you just think of something, if you think of that Jello, when you try and spin it, you can have multiple layers that are spinning separately. So those are much more dangerous hits. And you'll see when you watch hockey, a lot of those hits, the guy who's really damaged is playing, he's skating along, and you see him, all of a sudden he's hit like this, eh? And he's just spun around and bang. And so they're more dangerous, yeah. Yes?
You talked about psychotropic drugs. So is that Ritalin? One of the...
I don't know the answer to that. Ritalin does have psychotropic effects. I could look that up for you, but you could also Google that and actually find out. it wouldn't surprise me if you might be at slightly higher risk. I don't think it puts you at, like, it's not like it's going, oh, your risk is 500,000 times higher. I mean, if a mouse taps you on the nose, you're going to have a concussion. But it may make your risk a little bit higher. Good question. I'll look that up tonight. Dave?
A lot of times there's been, the kids that had a concussion, as they don't go to sleep. You touched on the fact that you have to wake them up to make sure. Is there anything to that you don't let them sleep at all for a period of time?
No, let them sleep. They are going to be sleepy. You're not really going to be able to prevent that. So let them go to sleep. But wake them. I mean, this is the part the parent always looks at me and goes, I got to get up every 2 hours and wake this kid up. This kid doesn't do well being woken up to go to school at 9 o'clock, so, but that's what you really do need to do. Let them go to sleep, wake them up, and if they can't, if they have very clear fuzziness, and you guys know your children, so some kids are very bright, and other kids, this is the way he always is. If you try and wake him up, this is nothing unusual about his behavior. It's when they're behaving very differently that you do need to worry. Yes.
So we know that wearing the helmet and mouth guard does not prevent a concussion. However, can you tell the parents that wearing both these gears could decrease the severity of the concussion itself?
I don't think so. I would never let my child on the ice without a helmet, and they should wear mouth guards to protect their teeth and their jaws and to prevent them from skull fractures. But, to be honest with you, I can't tell you whether or not it would actually reduce the severity of a concussion because, again, you're wearing a helmet, okay, and I come up and I hit you like this playing hockey and I spin your head. Your helmet doesn't protect you from that at all. And if I hit you hard and you're knocked way back and you smack your head against the back of the ice, it's protecting your skull from being hit that way, but your brain inside is still going like this just as hard, whether it was your bare head or whether you're wearing the helmet. So I don't think it really protects you in any way from being concussed. So don't, the message here isn't send your kids out on the ice without a helmet, okay? So don't, that's not the message. I just want you to understand that the helmet, you could have Johnny go out, with a great big Darth Vader-like helmet on, and skating around, and that's still not going to protect him from being teased at school or getting a concussion. Somebody, yes?
Why are females more susceptible than males?
I don't know the answer to that. Really, your brain matures faster and younger than a guy's brain does. So you would think that, if we're playing hockey at 15, you have your brain is probably about 2 years more mature than a 15-year-old guy's brain at the same age. So you would think that as your brain is 2 years more mature, that if you got hit, you would have less trouble with that. But there are a lot of things. Women have a greater incidence of anterior cruciate ligament tears in their knees. And yet your anatomy isn't that different than a guy's. So whether it's the way you play hockey, like women, because of the way women grow up culturally, they may not protect themselves as well as a guy does. They believe that anterior cruciate ligament tears occur because guys usually are a little more active when they're younger, and they generally learn to jump like this and land like this. And you'll see girls jump, and they'll often land like this. And that's a learned thing. That's not something that girls do, because it's programmed in their genetics, but landing with your knee in that position puts you at risk of this injury. So I have not read anything that's explained why women are more susceptible, but it is a statistical fact. So, anybody else? I'd like to thank you for coming out. I really do hope that this has helped you. If you do want a copy of this, David, I can give it to you. I'm happy to share it with you, but I hope that this helps you in the management of your teams and your children this year, and that we have a very safe hockey season and no serious injuries. Thank you very much.
Minor hockey, Dr. Merritt, thank you for this. And as I said, he's given us this presentation. We'll get it posted on the RMHA website, so if anybody wants it, we'll be there. And actually, Christine from, we're friends from the fire department, she's videotaped this, and I'm going to try and get maybe a YouTube link to it as well. So we can have this one in the can for other people in future times. So thanks for coming out, and it's great to see a good crowd.